Is Stephen Staples, who's the National Director of Policy and Advocacy for the Canadian Health Coalition. Morning, Stephen.
Good morning, Matt.
Thanks for being here. This is certainly concerning, I think, for those especially in the healthcare system. But take us through for the viewers that may not understand why, it is so concerning with the potential impact.
Well, I can hear that the goals that the Premier is putting forward is to attract doctors and shorten wait times for patients. Those are all good, but this is not the way to do it. This is essentially throwing a hand grenade into the hospital and letting it go off, and it's going to cause a lot of damage into our public healthcare system and will actually be counterproductive to the goals that the Premier is trying to do. See, what happens here is our public health care system, Matt, is essentially an insurance program that's paid collectively by everybody through our taxes. And so doctors, when they do procedures, they're able to bill the government for a set price for that procedure, and that's how they get paid. But what the Premier is proposing to do is to allow doctors to still work in that public system, but also run their own private clinics outside the system, and that's what's called dual practice. You have a private practice, and you have something inside the hospitals, inside the public system. Now, who pays for those services that are in those doctor-run private clinics? But the patient would, and primarily through private insurance. So this is really a huge gift to private insurance companies that will be offering special benefits, will be making profits from people to pay for some medical services offered by these doctors that are operating outside the system. And this is going to have a real corrosive effect on the public healthcare system.
And I think because doctors are incentivized right now, we've detailed it, right across the country, how difficult it can be, the amount of paperwork, I think, first of all, for family doctors and beyond in the public system, those lower reimbursement rates, which doctors do receive too, but just, the ability for them to, what would stop necessarily doctors, and I don't want to take anything away from them necessarily, from just committing more of their time and more of their, their energy into that private practice.
Well, you got it, because under the private practice, they can charge whatever they want. It'll be the free market will be able to determine that, and so you would pay for it, or it would be something negotiated with private insurance companies if you had a private insurance plan. And that adds a lot of paperwork as well too. That adds a whole other level. But frankly, I'm not sure where this is coming from. I was talking to doctors this morning, just this morning, and they're saying, we're not hearing from our colleagues in Alberta that this is a system that they necessarily want. They like the stability of the public system. It's a single-payer system. They know how much they're going to be paid. They don't want to be running private businesses and things like that. Some do, but I think the vast majority of doctors just want to take care of patients and not run these private clinics and businesses. But what happens is it will attract some doctors out of the public system into this private system, or they'll be doing, their time will be, allocated differently. That's the concern that the medical community has, the Canadian Medical Association and others, that while it'll create longer wait times for those people that are still relying on government healthcare system, the public healthcare system, their wait times will lengthen as more and more doctors go to this private system. Now, whose wait times will be shortened? Those people with the wealth and means to either pay for it themselves or to have private insurance. And so that's why you get what's called two-tier health care. Mm-hmm. There's health care for those that are wealthy, have the means, have private insurance, and then there's everybody else. And the wait times get longer for those people that are in the regular public system, and that's why every other province has very much discouraged this type of approach.
And do you think, Stephen, before I let you go quickly, at least at this point, is that if Alberta does move to this system, that it could encourage other provincial governments to possibly do the same?
Yeah, well, we'll have to see. There are other like-minded provinces, perhaps, that might want to look at this model. And that would be terrible, because what we would see is a kind of a slow erosion of our national system. And that's why we're reaching out to the federal government to look at what tools they have to evaluate. Does what Alberta is doing violate the Canada Health Act, the federal rules? Could Alberta lose up to $6 billion in transfer payments for health care? Could that be at risk if they go ahead with this plan? There's a lot of questions. We'll have to see the details, but this is a story that's going to keep going, and I hope that Albertans don't agree with this kind of system.
Stephen Staples, National Director of Policy and Advocacy for the Canadian Health Coalition. Thanks for your time today, Stephen.
My pleasure, Matt. Thanks.